Well, hello class. We will now be studying Unit 2 drugs, which will comprise exam number 2. There are 4 major categories of anti-infective agents in Unit 2. Antibiotics, antiviral, anti-HIV, and antifungal. In this module, we will be diving into drugs that prevent the growth of different types of bacteria. In the upcoming modules, we will be focusing on drugs that target viruses and fungal infections. This is a big module, and it contains a fair amount of drugs, so make sure you give yourself enough time to devote to it. The good news is that you probably have heard of or taken one of the antibiotics before. Any guesses to when antibiotics was first discovered? In 1928, Alexander Fleming discovered the first antibiotic, penicillin. Just think about the number of lives that were lost due to bacterial infections prior to this point in history. Since that time, the number of antibiotics available has markedly increased. Nurses need to understand how antibiotics work, when antibiotics should be used, when antibiotics should not be used, and how to prevent antibiotic resistance. You may have seen on the news about a very rare flesh-eating bacteria called necrotizing fasciitis. This is caused by a bacteria such as group A strep that invades the body through an opening through the skin, such as a cut or a scrape. The bacteria can produce a toxin which can spread very quickly throughout the tissue and surrounding the muscles, and it can cause death of the body tissues. It's pretty frightening. So as a nurse, before you administer an antibiotic or any type of anti-infective to a client, you want to think like a nurse and apply the nursing process. So even before you give the drug, you need to assess your client. How do you know what type of infection the patient has? Did the patient have a culture done before the antibiotic was given, so you know you're giving the right medication? We like to call this, do you have the right drug for the right bug? Does the client have any allergies? Should they not be getting this medication? Does the client have any other health problems? Or is the client taking any other drugs that may present problems when combining these two? This would be a contraindication. Now, after you give the drug, you still have to assess the client. You want to make sure the drug is working. So let's say you gave an antibiotic, like amoxicillin for bacterial infection. How will you know if that amoxicillin is working? Did the patient have a fever with the infection? So is the fever gone? Is the temperature back down to normal? Did they have an open wound that was oozing pus, and now the wound, after having the antibiotic, the wound has decreased its purulent drainage? Next, we want to assess for side effects. Maybe the medication is working, but it's also causing side effects. So you want to assess this in your client. You also want to assess for superinfections. Let's say the patient is getting an antibiotic. We all have a normal balance, a good normal flora that is on our skin of bacteria and yeast. And when you take an antibiotic, it kills off a lot of bacteria, not just the bacteria that it is intended to kill. So it may kill off the normal flora, and you're left with an overgrowth of yeast. And this is how a yeast infection happens when you take an antibiotic. What about client teaching? Make sure that you are teaching your client everything they need to know about that drug. Make sure you review how the drug should be given. Do they need to take that with food, without food? Are there any contraindications? What does the client need to know about that medication when they're taking it? And lastly, in this module, you will apply your knowledge to the care for Mr. Harry Hadley in your virtual simulation. He has a leg wound, and so in this scenario, you will engage in the care of Mr. Hadley so you can build your skill to safely provide care for a client undergoing anti-infective drug therapy.